declining COVID-19 numbers show some promise while vaccine delays and new variants are cause for concern. It's time again to talk about mental health. Bell Let's Talk addresses the pandemic pressures. Toxic and hostile. More details are revealed as the final report against former Governor General Julie Payette is publicly released. Humber News starts now. Hello, I'm Beatrice Baleiro coming to you with our virtual newscast from Humber College. It's Friday, January 29th. Here's what's making news. Ontario health officials released a new modeling this week, and while there are some positive signs with overall infection rates showing a decline, concerns about variant strains and confusion about vaccine rollouts are top of mind for many. The data shows that the stay-at-home order has resulted in a decline in cases and positive rates across the province. The provincial government also says hospitalizations are down, though the numbers of patients in ICU is yet to drop. And in the most vulnerable communities, increasing deaths ahead are expected.
We are making progress.
Ontario reported Thursday 2,000 new cases and 2,400 recoveries. Deaths are still climbing. However, 56 people died on Thursday alone. The vaccine could not come sooner. And for all, vaccinations cannot come soon enough. This week, it's debates over the number and delays in distribution. Ottawa insists Canada will receive the promised 4 million Pfizer doses by end of March. But in the short term, the number of vaccines expected in the next 4 weeks has been reduced by 80%.
I am cautiously optimistic, and I'm going with the data that I'm provided.
Pfizer anticipates Canada will be able to withdraw 6 doses of the COVID-19 vaccine from vials instead of 5. The difference has caused a lot of confusion among provinces and has raised doubts on Canada's rollout timeline. During an update this week, Major General Danny Fortin said Canada will receive 4 million doses of the Pfizer vaccine by the end of March.
Those discussions are taking place with Health Canada colleagues, and that's being assessed by them at this time. So I'm not at liberty to speak to this.
Canada was set to receive 366 Pfizer vaccines this week, but now have to settle for 79,000 and will also receive 70,000 next week. Provinces are preparing to ration dosages and change their inoculation plans amid these new details. So far, 317,000 vaccine doses have been administered since its arrival on December 15th. In Ontario, more help is needed as ICE turn to places with major outbreaks, one in a senior home and another in a workplace. Aurelia Soldiers Memorial Hospital has confirmed that a Barrie long-term care home is battling one of the COVID variants. As of yesterday, Roberta Place has more than 100 cases inside the home. 46 residents have died and an essential caregiver, bringing the overall death toll to 47. Right now, it's acting as an acute care palliative center rather than a senior home. Has been receiving help from other 2 hospitals in the area. Meanwhile, in Mississauga, Canada's busiest mail portal facility has been dealing with a major outbreak in the Gateway facility. Canada Post has confirmed more than 200 positive cases. An entire shift of workers were sent home last week to isolate. One of them was Godfrey Young, a 61-year-old man who last worked on a night shift on January 18th. The Canadian Union of Postal Workers reports he wasn't showing any signs of symptoms prior to his test, but later died on Monday. Canada Post released a statement online sharing their condolences. We offer our deepest sympathies to the family as they mourn the loss and respect their privacy during this difficult time. We are focused on supporting our employees who have lost a colleague while ensuring we continue to stringently follow the guidance and direction from Peel Public Health. Peel Region health officials refuse to comment whether this is from a variant case, as investigation is still ongoing. This week's modeling by Ontario health officials say the new COVID-19 variant could soon become the dominant strain. 43 cases of the COVID variant B117 have been confirmed in Ontario. Health officials are reporting that the strain is 50% more transmissible than earlier variants. Modeling released Thursday suggests Ontario could see 750 cases of the new variant per day by the end of February.
And perhaps most worrisomely, the new variants of concern, the mutated SARS-CoV-2 virus, are clearly spreading in the community and will likely be the dominant version of the virus in March.
Brown said that COVID-19 vaccines appear to be effective against the UK variant of the virus. Prime Minister Trudeau has announced more travel restrictions due to concerns with new variants of the virus. Canada's main airlines will be ceasing all flights to Mexico and the Caribbean for the winter season until April 30th. For those traveling internationally to Canada, they will be restricted to Vancouver, Calgary, Alberta, or Ontario's major airports. Upon arrival, travelers must complete a COVID-19 test and stay at their own expense in a recognized hotel for a 3-day period awaiting results. With those testing positive, they must stay at a hotel, whereas those tested negative must quarantine at home for 14 days under strict guidelines.
We're doing this to keep as many Canadians alive and healthy as we can through this pandemic. We're taking difficult measures now so that we can get through this quicker, so that we have less damage to our economy, to our industries, to our workers, to our lives.
In fear of the numbers spiking in Canada, this leaves many travelers and airlines worried about what may be next. With new variants, tighter restrictions, and delayed vaccines, Canadians are struggling with stress now more than ever. So the annual campaign Bell Let's Talk Day aims to raise awareness on Canadians' mental health. It's been a challenging year for many as COVID shifted people's lives and caused unprecedented pressure on those affected. In a recent survey done by Mental Health Research Canada, more Canadians are feeling anxious and overwhelmed this year. As for students dealing with schooling at home, stress levels are at a high.
When we talk about the pandemic and COVID-19, what we can't forget is that there already was a pandemic relating to mental health.
To show support, Bell launched a post-secondary fund to aid students in Canadian colleges and universities. The fund is set to help schools improve their existing resources to assist their students better.
As a government, we will continue to invest in mental health services. But as individuals, we can all play a role in helping break down the barriers that people face when it comes to dealing with mental health issues.
By sharing posts with the hashtag #BellLet'sTalk, 5 cents will be donated to Canadian mental health programs across the country. Since its launch in 2010, Bell has donated over $130 million towards health initiatives and has partnered with more than 1,000 organizations throughout Canada. Mental health and stress have been the front and center in the federal government as the scathing independent report examining former Governor General Julie Payette's workplace behavior was released this week.
As a government, we've demonstrated time and time again how important it is to create workplaces that are free and safe from harassment, and in which people can do their important jobs in safety and security. That is why
Trudeau spoke in front of Rideau Cottage last week about his highest governmental appointment having to resign due to scrutiny of creating a toxic work environment. The final report from Quintet Consulting Corporations is now publicly released, and in it more than 90 current and former employees as well as those considered knowledgeable individuals were interviewed. Almost half of the staff members described the environment as hostile or negative, and others say it was toxic or poisoned. The heavily redacted report revealed detailed accounts of yelling, screaming, aggressive conduct, demeaning comments, and public humiliation. It went on to conclude saying, "There is a serious problem that requires the Privy Council office's immediate attention." The Prime Minister sat with Payette last week when the allegations came out.
We moved forward on significant measures for Parliament, for the public service, and why we consider that we needed to accept the resignation of Julie Payette, given the concerns that were raised.
Assunta De Lorenzo, one of her top staff, also resigned the same day. Away from politics, as the COVID-19 pandemic continues to hold most of major fashion events, brands and designers had to think outside the box. Major fashion capitals, including Paris, are holding audience-free online fashion shows during this year's Fashion Week. Labels turn to video presentations for the editors, buyers, and influencers who are usually the main audience of the event. One of the highlights of this week in Paris was Dior's spring collection, inspired by tarot cards and astrological signs. Designers choose to address the current pandemic situations through their clothes. Since the tarot cards are often used for fortune telling, the mystical design is supposed to provide a glance into the fast-changing future.
But the real thing is that can help not to be afraid about something that you don't know, about the future that is so uncertain, so insecure.
Designers are hopeful that although the life around changes, one day they'll return offline. That's all for today. I'm Beatrice Baleiro. Humber News is written and produced by students in the journalism program. For more coverage, visit our website, humbernews.ca, and follow us on Twitter @HumberJRNL. We'll see you next time.